Thank you all for joining us at the fourth in our summer series of lunchtime webinars. Today, I'm delighted to be joined by Robert Ramsden, and Rob is from PCSE, and he's going to go through a series of questions with me that have been asked by our members. Hi, Rob.
Hi, good morning.
Okay, so just to remind you who the IGPM are. So my name's Kay Keane and I'm a practice manager at Alvanley Family Practice in Stockport. And the other directors of the IGPM are Joe, Robin and Nicola, but our faces will be familiar to all of us, I'm sure. So Rob, I'll just hand over to you on this slide. Do you want to give us a bit of an overview on where we're up to now with the transition of services from what we used to call health agencies over to PCSE?
Yes, absolutely, Kay. So I work in PCSE's communications team and I've been with PCSE since 2016. So I've been through these transformation programs. The first two that you'll be familiar with were the transformation of supplies and records, which did transform those services, but you'll also notice with those that all general practices were then set up in PCSE Online as entities. So we weren't reliant on NHAES, which is the system that has sat behind these services. We were moving them to a new platform. And then following that, we had the transformation of Performers List in December 2019. That meant that all GPs then existed in PCSE Online. And then from general practice perspective, you haven't probably heard from any transformation activities for about 2 years. And that's because we were focusing on ophthalmic payments in the ophthalmic sector and pharmacy applications in the pharmacy sector. But that meant that we then had the payment systems transformed and in PCSE Online. So as of the 1st of June 2021, GP payments and GP pensions also launched in PCSE Online. And it's the last of our big transformation projects, and everything is now hosted on PCSE Online. The last thing to come will be patient registrations, but that's an NHS digital program, but obviously that will impact PCSE and general practice staff as well when that comes around.
Okay, and that's really good to have that timeline as well, because we can see that back in, was it 2016 when the contract started, some of those supply issues, some of the records issues did have problems, but we've worked together and kind of iron those out now.
Yeah, absolutely. I think it's worth not forgetting the issues that we had when we moved everything from one platform to another. Just like things like not recognizing branch practices or not recognizing how big some practices were. It's not just limited to one site. So there were some issues, and for supplies and records, they did take a while for us to iron those out and get them fixed. But hopefully over the past couple of years, you've felt like those two services run fine.
So some of the issues that we're seeing with the payments and pensions now are because we're just in that transition phase.
It is, and we are trying to learn from past mistakes where we need to get these things fixed a lot quicker, especially with it being payments and finances, and it's so sensitive and essential to running general practice. So we did attempt to iron out a lot of the data issues that we saw before the service went live. We did have a period of testing cycles even. It's not just one period, it's multiple cycles. But as soon as you get that system up and running and you put real data in it and start running real scenarios, it's flushed out everything else that we couldn't have predicted.
Okay, and as you say, as it's about finance, and some practices, well, lots of practices are running on a very tight budget. So as soon as one thing is missed, it does cause massive anxiety and in some cases real financial problems.
Yeah, I absolutely appreciate that, Kay.
Yeah. Okay, so shall we go on to some of the questions that our members have put to us?
Absolutely.
Okay, so lots and lots of questions and comments and lots of examples of payments missing, deductions not paid or double paid, or issues of things that have happened that weren't expected by practices. Can you give us a bit more information about the pension contributions and deductions and how things have gone wrong and how we're fixing them?
Yeah, so this might be a bit of a long answer, but I'll try and keep it as short as I possibly can. So I think the most common question that we're getting is that pension deductions haven't been made, so they're missing from the monthly practice payment. There's no deduction there, and there could be multiple different root causes for that. So even though it's just one thing that you're experiencing in general practice and it seems like it's one problem, it could be that there are multiple different root causes. Now, when I talk about the transition from NHAES to PCSE Online, it sounds like it's just moving from one system to another. But when NHAES was first created, there was 82 different versions of it, which matched how the country was split up at the time when the system was built. That means that there were 82 different logins, meaning that if you worked in a PCSE service line that needed to use that system, you had 82 different usernames and passwords. And if you had somebody who existed in one instance of NHAES, so if you had a GP move from one area to another, they would have two entries in two different systems.
Oh, okay.
So it's a really like old-fashioned way of managing data. And
Can I no, it's okay. The NHAES, as you call it, is that what we used to refer to as the Exeter system?
Yes, it's exactly that. Yeah, it sits behind OpenExeter, but we call it NHAES.
NHAES, yeah.
So we've taken all that data from those 82 instances of NHAES, we call them, and moved them into one instance of PCSE Online. And it could be that the data is saved in different ways in each of those 82 instances. Part of the remit of PCSE taking over these services was to standardize all the processes. So anything that we've touched since we took over the service will be in a certain format. Anything prior to that is not. So when we've moved things over, we found that some things we would say missing, but it just means that it isn't where PCSE Online thought it was. So there's been some gaps when we've got the data into the new system. And practices calling up and raising these things with us has been really useful because it's allowed us to look at that one scenario, track it back, and if it's impacting one practice, chances are it's impacting another. So for the past 3 months, we've been raising these things as defects, we would call them, where the system's not able to do what it should be doing and getting those fixed. The most common one with missing pension contributions is that the SD number, or I think it's superannuation, I'm going to say division. It's basically your NHS pension scheme number is your SD number. It may be that either that wasn't held in NHAES, so when we've mapped the data over, we just don't have that figure, or it's somewhere else in NHAES where PCSE Online wasn't looking for it. And in the past, when we've manually done any updates to pensions, you've got a human being who's sat there checking everything over. So they could have used a national insurance number, for example, and done that update with NHS pensions. But now we need the SD number. If it's not there, we've not been able to take contributions. One thing we have been able to fix is in the past 3 months, we've been doing that manual interrogation, and anyone with missing SD numbers, we've been updating them, but we've updated them all in one go in September. So that problem should have gone away, and we think we've got the bulk of all the missing pension contributions.
Okay, so just to help me get my head around these 82 different systems, I'm guessing that was because there was 82 different local offices processing the data for their group of GPs, and they may have done it in slightly different ways. And I guess from a way that practice managers might be able to understand that, if we're all using the same computer system or a version of that, but we can get records sent to us from one practice to another that have degraded entries because one practice has written things in a different way or used a different coding structure. So to then multiply that by 82 times, I can kind of understand a bit of that problem. Is there a reason why it couldn't have been tested in real time with real data before it went live? Is that just because it was too big?
No, so the last, you'll remember, I think September last year, we were initially planning on going live with this, and that was to do the final test with real data, but anonymized data. So taking everything that existed in NHAES, anonymizing it, putting it in the new system, doing a payment run. And that flushed out that the system wouldn't be able to run quick enough to put it live at that moment in time. But we'd also flushed out some data issues with that as well. So there were some things where we were able to fix it ahead of time, but there were some things that you wouldn't know until you got the data in there and then let the system run in real life.
Yeah, and humans at the other end checking what they expected to see was the right thing. Okay, so what you're saying to me now is that to the best of your knowledge, the September changes mean that we should now be in a much better place, and practices should be seeing that things look right to them.
Yes, so I'm sure you're going to ask me some more questions about this where I can expand on it a bit more, but I think from a data perspective, where we are just basically mirroring what was in NHAES, filling in the blanks, those things should be fixed in September. But there are some other scenarios where it might be that a practice is saying you haven't taken my pension contributions, but it could be a completely different root cause. But if you ask me about those, let's answer those as we get to them, if that's all right.
Yeah, no problem at all. No problem at all. In some cases, we've had members that are saying that they've been still getting deductions from GPs that have left them, or they've got a new GP that's joined them and their deductions haven't been taken. What's happened in those situations?
So we need to look at the specific scenario to say for definite, but I'm going to give you two potential reasons why this is happening. So where we have GPs who have left and we're still taking deductions, prior to the launch of GP payments and pensions in PCSE Online, stopping the pension contributions was fully dependent on the performers list process. So if you had a leaving GP who didn't update the performers list, so they didn't go to work at another practice, so they didn't see the urgency in updating it and have just left it, the pension contribution still ticked along until they did that. Like, the power was entirely in the GP's hands. What you can do now as of the 1st of June as a practice manager or someone at the practice with the correct permission to do that is you can log into PCSE Online, and as soon as you know that someone is leaving, you can go on and go to the leaver screen and enter that data in there. And once we hit the date that you put in there, we won't take any more pension contributions. So the GP still needs to log in and update the performance list details, but it's not going to impact your cash flow, have any kind of financial implications.
Okay, so that's an important thing for practice managers to remember, to go onto the leaver screen, and you can put a forward date in, can you? So if we know someone's leaving on the 1st of December, we can put that date in now and kind of forget about it and it'll happen.
Yeah, absolutely that. And this scenario where we've got someone who is still paying contributions for someone who left in September, you can log into PCSE Online and you can backdate it as well.
Oh, right, okay.
The system will automatically backdate pension contributions to the beginning of the financial year. So if they left prior to the beginning of the financial year, you then need to raise a case with PCSE to ask that we manually backdate the rest. But if you're within the current financial year, the system will just do it automatically. Okay,
and we don't need to add any evidence to that? So it's just we say they left and that's it?
Exactly that, yeah.
Okay, brilliant, thanks.
So the other scenario was another practice has a salaried GP whose contributions have not been taken since November.
Yeah.
So when it comes to joiners, which is the flip side of the leaver process, that is still fully reliant on the performers list process. So the GP needs to have logged into PCSE Online, change their details, whatever details need to change. So if they're going to work at another practice, if they've got married and changed their name, if they just want to update the phone number or email address, they log into PCSE Online and update that. And then if there's an action required off the back of it from someone else, it triggers that process automatically in the background. So if they have a change in practice, that means that the practice that they're leaving and the practice that they're joining need to approve that change.
Okay, and they get an email to do that approval?
They do, yeah. You get an email notification, and it also goes into your messages in PCSE Online at the top as well.
Okay, so I can speak freely about GPs on this call because we're amongst friends of yourself and practice managers. So we're reliant on a GP logging into a system to change their details.
Correct.
Okay, so if that GP doesn't do that, what can the practice do to fix it? Can the practice say that that person is a so what was he? Was he a joiner? No.
Yeah,
Oh,
it's
yeah,
just
so he
about
was a
joining, yeah.
joiner. So can the practice add them as a joiner and then get an email sent to the GP to get them to update their details?
No, so the joiners process, it will only allow you to submit that once the
Yeah.
performers list element has completed.
Okay, so message to practice managers then is when you've got a joiner, make sure that you get that joiner, that GP, to update their details, and that's kind of a matter of something that they need to do within the first month of them being with you, I would imagine.
Yeah, I'd make it, but even they can even do it before they
Yeah.
actually join. They can put the commencement date in the future.
Okay.
It's just that you won't be able to physically do the joiner part of it, start the pension contributions until they start.
Okay.
But it'll be there ready for you to do it if you
Okay.
get them to do it.
So that's a good thing for induction packs and induction checklists for us to add. Great, that's a good tip. Thank you.
No worries. And I promise you, it's really easy. Like you just log in, and if there's a bit of information in there that's not right, you update it like you would your Facebook profile or your Amazon account. It's the
Mm,
same thing. If it's out of date, change it, and it
okay.
just triggers more complicated processes behind the scene. But the GP doesn't know that.
We'll try our best to sell it to them.
Okay.
Okay, so we had loads and loads of really specific questions as well from practices that are really struggling to find the right information for their unique circumstances. So we can't answer all of those things on this webinar. Is the best thing for them to do to load it on your case system online and get a case reference number and try and work it through that way with you?
I mean, if that is one way to get in touch and get it fixed. I would probably say the first step is to log into PCSE Online. Just make sure that you've got the performance list tile, the pensions tile, and have a click around and see if you can find the information. That'll familiarize you with the system, but it should also give you some visibility about what has or hasn't happened. Alternatively, you can call up. So if you think that you are waiting on a GP putting through their performance list change, if you call our customer support centre, they can have a look to see whether or not the GP has done that.
Okay.
And then if it's something a bit more complicated, or you know that it's a bit more complicated, you can raise a case through the PCSE website and get someone in our performance list team or our pensions team to look at it.
So those people that answer the phone can look to see whether the GP has done their bit.
Yes. So what I talked about with the 82 instances of NHIS, and I promise I'm not going to keep going on about this, but that's been a bit of a blocker for our customer service in the past, because it's just, you can't, I mean, you could give them 82 logins and passwords, but then it's reliant on them finding which instance you live in. Like, it just wouldn't be
Yeah.
realistic. Whereas now it all lives in PCSE Online. In some instances, our customer support centre can just have a look on PCSE Online, and they do have a broader view than what
Okay.
individual users at the practice have. So
Okay.
try them first. If they can't find the information for you, they'll tell you what you need to do.
Okay. And you would just need identifiers for that GP. So perhaps national insurance number, name, date of birth, that kind of details.
GMC number's probably the
GMC
best
number.
one for
Okay.
us. So name and GMC number. Yeah.
Fabulous. That's great. We should have that information. Brilliant. Thank you. Okay, so thanks for giving us some really good information, some really key ways of us as looking at different, you call them tiles, didn't you, on PCSE, different areas of the system. So for practice managers who are busy and have got, tons of things to remember, have you got a simple checklist of what we do when we have a joiner or a leaver that we can follow, just a simple guide?
We have individual guides for individual processes, but the idea of a checklist sounds like a really useful thing for us to focus on next. So I'll take that away and I'll see what we can do. It might be that we have some kind of, it's a checklist, but it links off to other guides.
Okay, yeah, that'd be
So that
good.
if you don't understand what the point on the checklist is asking you to do, you can still go off and get to the guides that already exist.
Yeah.
It might be something that we work with IGPM on, just to
Brilliant.
say, we think you need this.
Yeah.
Can you check and see if that's all right?
Yeah, because there might be practices that have got such a wonderful static workforce that they don't have to have a joiner or a leaver for years and years and years. So it's not something that we do regularly. So I think that would be a really good piece of work for us to do together.
Okay, yeah, let's do that.
Thanks. Just some final questions about pensions. If a GP wants a pensions estimate, that's not through you, is it? That's from the pensions agency that's now part of the BSA. Is that right?
It is, yeah. It's NHS Pensions who would do a pensions estimate. What this question might be referring to, though, is if you have any like missing years, let's say you've not done your 17-18 certificate for whatever reason, you can't get a pensions estimate beyond that missing year, even if you've submitted your subsequent years.
Okay.
And NHS Pensions will often signpost people back to PCSE to say speak to PCSE to find out why we can't generate an estimate. So it might be that they're referring to that, but logging into PCSE online now, when you go to complete a Type 1 or a Type 2 certificate, it asks you to choose the year that you want to complete and submit.
Mm-hmm.
And if there's a year in there that's in red, it means that we've never had it.
And that's something the practice manager does, not the GP?
That is something that the GP does and not the practice manager.
Okay, interesting.
Yeah, so you do, and how the roles are set up in PCSE Online, there is a practice accountant role, which would give someone like a finance manager or a practice manager visibility of this stuff. Yeah. But it's designed so that it's the GP's responsibility to sign and submit their certificates. Mm-hmm. So the system's built as though it's going to be the GP who's completing it.
So in reality, that might be that it's a function that the practice manager does on behalf of the GP, but that would be sharing the GP's pass username details, would it?
Oh, so we'll never ever suggest that anybody does that.
No, but I'm just trying to think. You said that there's a finance function. Is that finance function one that would enable the practice manager to do that on behalf of the GP, or would there have to be a practice manager sat next to a GP? No.
You could do it on behalf. So I think it's just called the GPP accountant role.
Okay.
And that allows someone with that role on their PCSE Online account to complete Type 1, Type 2 certificates on behalf of someone.
Okay.
So whoever ends up with that role, it's not really for us to say. It could be the practice manager, it could be an external accountant.
Yeah.
It'll allow you to see those details and complete those certificates. And then once they're completed, the GP still has to log in, check that the details are correct, tick the declaration and hit submit. So you can't just do it all for them, but you can do a lot of the legwork and the admin.
Okay, and what did you call that? You called it a finance function?
GPP accountant role.
Okay, so that's important for practice managers just to note down that they need that role as well, perhaps.
Perhaps if they want to do that work, yes.
Yeah, thanks. Where do we find the details of our population? Where's that statement that says what our current or our 1st of April population figure is? Where do we find that on the online system?
The statements now in PCSE Online, you'll probably find that you get fewer statements, but with more information in there. And the population figures are found on the monthly statements, but you have to expand on the global sum line to be able to see that detail. It's like it gives you the top line and you have to click a little plus button to expand it and give you the detail.
Okay, and that will give the detail of the actual population and the weighted population?
That information is on there. I'll flash up a screenshot to show you what level of detail you can see on your monthly statements.
That's brilliant. That's really helpful. Thanks, Rob. Okay, so we then had a whole lot of questions about people who had various elements of their contractual payments missing or weren't paid in a particular month. How do people find help on that kind of situation?
In most scenarios where we've where you've experienced a late payment or not received the payment when you expected to, it's something that we're already aware of, and we're working with NHS England and the commissioning teams to make sure that that payment is either made on the next contractual payment run, an ad hoc payment run, or some other faster payment method. So most times we know about this, and we'll send communications directly to impacted practices to let you know what is happening with that. I think in the first 3 months of the service being live, we were probably a bit slow off the mark with getting that message out. So you felt like the money just wasn't there.
Mm-hmm.
Nothing was happening with it, and you felt like you had to ring up. We are a lot better with that now. So as soon as we know that there is an issue and we know who's impacted and what the fix is, we come to you and let you know.
And my advice to anyone that was having that would be to make sure that your commissioner knew as well. So make sure your CCG knows, if necessary, your LMC knows, and they will try and support you if this is putting you in financial difficulty as well.
Yeah, so obviously we're working with the commissioners. So in most scenarios like that, they'll already know, they'll already have the list, so they'll be expecting it. But for financial difficulties, they might not necessarily realise that this payment being late is going to have detrimental financial impacts. So that's the kind of thing that you want to raise with them. I would say it's worth pointing out as well that the commissioners are now uploading payment schedules directly to PCSE Online. So they've had quite a significant change since the 1st of June. In the past, they used to put all this information onto spreadsheets, email them to PCSE for PCSE to enter them into NHIS. But we're taking that step out now, like commissioners can access PCSE Online. We're using PCSE Online. It makes sense for them to take that same spreadsheet and upload it to PCSE Online. But there have been some like teething problems with how it's working, the things that people are putting on the spreadsheet not being recognised because it's not used the right pay code, or it just being a bit clunky. So we are working with commissioners to make sure that they fully understand what they need to do, what's expected of them. We've also recently made some changes to the process at their end as well, just to try and streamline it. So if they are up against deadlines, it's a bit quicker for them to get that information in there. So that has already evolved quite a lot in the past 3 months, and we shouldn't experience as many issues as we've seen with late payments of the past 3 months.
That's really good background information as well, Rob, so that we can understand that they have a part to play as well. Great, thank you. So, Rob, if we think about individual lines on that statement, it currently doesn't say what that description is for that line. So we'll have an amount of money, but not, what it relates to. Is that going to change? Is that something that you're developing, or is that going to stay like that?
So on the new statements, there are descriptions, so you have pay codes and descriptions. When I talked about that spreadsheet that the commissioners upload, the pay code is something that they absolutely cannot change, but they can overtype the description. So there is a description associated with the pay code, just as standard, but the bit that can be overtyped is the description. So it may be that if something is unusual, not regular, practices are not going to recognise it. There is some wiggle room there for the commissioner to call it something else.
So those pay codes, is there a list of what all the pay codes are so that we could look back at the pay codes?
So this template that the commissioners use, this Excel spreadsheet, that is on our website for anyone to view. So you can see them on there. The list of pay codes that are on the website at any moment are the current set of pay codes. So it might not be useful to use that list to look at any that are from last year or the year before.
Okay. And I suppose that the other thing that we can do is contact our commissioner and ask them what that payment relates to, rather than contacting you and asking you what that relates to. You'll only have the information that the commissioner's put on the spreadsheet. Is that right?
Yeah, and that's always been the case. So whether they emailed it to us or whether they're uploading it themselves, we can only go on what the commissioners put on that spreadsheet. One thing I will point out though, because I know the commissioners have been raising that they're getting a lot of contact from practices about pension contributions, and that's not anything to do with commissioners, it's just your contractual payments. So the missing pension contributions, that's entirely PCSE and PCSE Online and NHS pensions, whereas
Okay.
contractual payments, whether that's monthly, ad hoc adjustments, that's commissioners.
And when we're talking about commissioners, we mean CCGs, don't we?
CCGs on the most part, or in some areas, it's the NHS regional team. It's whoever administers your payments in your area.
Okay, great. Thanks for that clarity. So that commissioner that's filling in the spreadsheet, if they realise they've made an error, is there a good line of communication between commissioners and PCSE?
Yes, I would say the majority of customer contacts that our GP payments team get is from CCGs or NHS regional teams. So they have they can raise cases the same as what practices can. They also have a direct email address as well, which they used to use to send through the monthly payment spreadsheets.
Okay.
They now use that to send through queries. So yeah.
Can you give me the standard response times via the portal if we as practice managers contact you?
It's for response times or timescales for us to resolve the query. It's completely dependent on what the issue is that you're raising, but we do aim to acknowledge all queries within 3 working days. And that acknowledgement is to say that a case has been created or it's been assigned to an individual and we're looking at it. It's not necessarily guaranteed to be a resolution.
Okay, and you'll give us a case reference number. I can't remember. Is that what you call them? Case reference number? So you'll give us a case reference number at that point, and if we need to speak to you again about that, that's the number that will stay with that case all the way through. We've had some members who have said that it gets confusing with different case reference numbers that are given at different times during that resolution process.
Yes, and I would agree that it can get complicated, especially when you've got more than one case open, which often practices do. But yes, anything that begins with a CAS is a case reference number, and that is associated with that query up until that query is closed. So if a case remains open, you use that same case reference number every time you want to give us some more information or ask a question about that case. It's the same case reference number.
And currently, there's nowhere on your website or the portal where you can track cases, so know which are open and which were closed. I just know that some of my colleagues end up keeping lists of things that are open so that they can keep track of them. Is this something that you might consider?
I think it's something that we need to consider without committing to that, because I don't work in IT and I don't know how possible that is. But yeah, we're aware that you're working a little bit blind and you raise a case and then it's like over to you to track it. So there's nowhere that you can go in and see a list of open cases. But when you do go to the inquiries form, for most services and most queries, it'll ask you if your query is relating to an existing case.
Yeah.
And if you tick yes, and the existing case is still open, you can put the case reference number in there. And then when we get the query, it just adds that follow-up to the existing case.
Okay.
Because we don't at our end, we don't want you to have 2 different cases about the same thing. No. Because they'll be sat in our queues for people to work. So we want to streamline it as much as you do.
So could the IGPM work with you to try and find a better way of doing that? We can give you some examples of where in our clinical system suppliers, we can go to a page and it will show us all the ones that are open. It can show us when they've said something and we've said something, and it becomes much more automated. Could that be something that the IGPM work with you to try and benefit you and us to streamline that process?
Yes, absolutely, and I think that's something that we should look to do. Now that we've got the majority of PCSE services running through PCSE Online, I think we should now move and focus on how to improve the customer service experience. So the self-serve bit is kind of done, it's ticking over. Yeah, we've got some defects that still need resolving, but let's shift us focus to, if you need to get in touch, how do we make that an easier experience?
Brilliant, and we're happy to work with you on that for our members.
Great.
So it's difficult for you to give us, you've said 3 days for acknowledgement, but it's difficult for PCSE to tell us a resolution time because if we go back to that, there's 82 different versions of a system. There's things that are reliant on us as practice managers and of GPs and of commissioners. For you to say that things will be resolved in 28 days, for example, is reliant on so many different factors. Is that possible for you to give us a resolution time frame?
It is possible. I think right now at this moment in time, because we've got the GP payments and pensions system, which does still have some defects that we have in a plan to fix. And when I say in a plan to fix, it means it has to go through the development and test cycles before it's deployed into the system. So because we have this unusual scenario going off this past 3 months, that's derailed our timescales a little bit. But I know our customer support center are really keen to get us back to letting you guys know the maximum amount of time to wait for something to be resolved. So even though we do have external factors and whatever else, we should be able to get to a point where we can say, if everyone does what they need to do, this can be resolved within X days.
Okay, and I think it's really helpful. I know, and PCSE has had a bad press, quite rightly, in some areas, but it's interesting to know all of those factors that are behind the scenes that mean that you can't do your job properly, which then makes us unable to process things or receive payment. So that visibility has been really useful for me this morning. Thank you.
No worries.
So when we're raising something on the PCSE portal, some of our frustrations are because we have to give it a specific, what would we call it, a specific category or a specific area. And sometimes it's not that cut and dry. It might be multiple areas or it might not quite fit. How's the best way that we can do that? Do you want us to just pick one and go for it?
So no to that. So I think one of the big challenges that we have with not meeting timescales is where a case has been created and it's sat with the wrong service or it has the wrong case type, which means that somebody who's skilled in the area that that's been categorized as opens it and then sees, oh, this is not one for me. I need to send it where it needs to be. And then it goes into the queue in another service line.
At the bottom of the queue?
Yes.
Okay.
Yes. So everything is kind of worked chronologically as and when the teams receive it.
Okay.
There is the ability to escalate and mark things as high priority, so they're picked out sooner. But if someone's skilled in one area and they get a query about something from another, they might not necessarily realize by looking at it that that's high priority. So it just goes over into the queue for that team to work with. So I would say don't take a guess. I think if we think back to when you asked about the performance list changes, and I said log into PCSE online and have a look, ring up the customer support center if you're not sure, I would say do those. There is the capacity to speak to a human and ask them for their advice. You don't have to go onto the form. But the flip of that is, if you know that this is absolutely to do with GP payments, go onto the form and just put it in there.
Okay.
But if you're not sure, ring up and ask or log on and check.
Okay. Okay, there's lots of frustration about resolution times. There's people who are telling us that it's taking them 40 days to get a response. They feel that all that's left for them to do is to raise a complaint to get things escalated. And we don't want to be that we don't want to have that relationship with you. We don't want to be making complaints. But 40 days is too long if it's about a payment. 40 days can make or break a practice. So we've got to get better at this. What is your process for getting better at that response time?
Okay, I appreciate that people raise complaints out of desperation, and that's the only place at the minute where they feel like they're getting a timescale quoted. With the launch of GP payments and pensions, we are seeing increased call volumes and we are seeing defects and things that we're working on without telling you. And I acknowledge that none of that helps. If our communication is poor and we don't tell you that we know about an issue and we're working on it and when we're going to fix it, that is going to leave you potentially stressed out and feeling that you have to raise a complaint. So I am sorry for the past 3 months and what you've experienced, but we are working on getting back to a reasonable time frame and just move these things into business as usual. So prior to the launch of GP payments and pensions, we were working at around 10 to 15 days to resolve a payments query, depending on how complex it was. And we're aiming to get back to that. And then moving forward in future, because of now how the system works and all parties have more transparency, we should be able to get that down further. But we at least want to get back to where we were before. And it is taking us some time because we have defects and things that didn't work exactly how we expected that they would work. But we're confident that we know about all these things now and we have plans in place to fix them. So this is going to be our priority, that we get the timescales under control, or at least provide some more transparency.
So I'm just going to push you on that a little bit. So it's great that you say you're going to improve things, but what happens to that practice now? If a practice today is in financial difficulty because something hasn't been paid and the resolution time doesn't seem to be happening, and today they're in financial difficulty, I'm just thinking, payroll's being done, bills have to be paid. What can they do today if the complaints process isn't necessarily the right thing?
And I would make sure that you've raised it with us or raised it with PCSE in the first instance. If it's becoming urgent, then speak to your commissioner and make them aware of the implications of PCSE not meeting that payment, and they can then get in touch with us to drive that forward.
Okay, and you said earlier on that they've got a different communication route with you. They've got a different telephone number and way of talking to you, have they?
Yeah, they've got a dedicated email address for payment queries, but for us to be able to mark something as urgent and escalate it, the case needs to exist in the first instance, which is why I'm saying always make sure that we know about it first of all. You've given us all the info we need. Then if something becomes urgent, it's easy enough for us to just move it to the front of a queue and get it worked.
So for a practice manager who is feeling stressed, end of the tether, don't know where to go next, with your case number, go to your commissioner and give them the case number, explain the problem, and they can act on the practice's behalf and escalate that issue.
Yes.
Thank you.
Yeah.
So as things go forward and, we hope that we've gone through the worst, we hope we're kind of going into that business as usual now. Is there currently a practice manager representative on or a working group that work with you to help you through issues and problems as things appear?
So the contact that we've had recently with the IGPM has been a really useful channel to get practice manager feedback. So you will know as a practice manager yourself that we have feedback stars scattered everywhere in the service. We have this YouTube channel where people can post comments. We don't necessarily get the most constructive feedback through those channels. Whereas speaking to IGPM, you guys kind of translate that into this is what this means. Yeah. So I think it's really good that we maintain this relationship. And if there's that appetite to have a bit of a working group or regular webinars, then I think we should set those up.
Yeah, and we're happy to do that. We've got regional representatives, so if there's a problem in a particular area, we can get a regional rep to work with you on that, or the IGPM directors are certainly happy to work with you on any issues that might affect our members. You mentioned our YouTube channel. Now, that isn't something that I was aware of until we've had some conversations. So can you just tell me what's on that YouTube channel? Are they how to fix things, how to work the system? Is it that kind of stuff on there?
It's generally how to work the system, and it's more the happy path stuff. So if everything goes as it should do correctly, everyone's happy, and it's more that. So it's more educational around this is what I should be seeing throughout these processes. And then if you're seeing something different, it's kind of saying, right, I need to let somebody know because this is not working as it should.
Okay, happy paths are what we like.
Okay, I mean, happy path, all the videos that are on there have been recorded by me using the anonymized dummy data in the test system. Okay. So that's me testing them and knowing that they work, the process works. Okay. But if you've got a different scenario and some different data in there, it might be doing something different. Okay.
And I guess what we could do if we hear themes coming through from our members, so for the members that are listening today, speak back to your regional rep and we can start collating issues and we can go back to Rob and his team and we can talk through those real specific things if we think that's useful for everybody. That's okay, Rob?
Yeah, definitely. And also, if anybody watches one of our videos on YouTube and they feel like this doesn't give me what I need, I want this scenario, put it in the comments, because again, it's me that reads those comments and they help shape the future stuff that we do. So if
Okay.
Happy Path is just not doing it for you and you want some, what happens if this thing goes wrong, then let me know and we'll look at what we can do.
Brilliant, thank you. So, Rob, you talked about YouTube. Are there any other ways that we can get advice or learning? Is there anything on your website that we can go to and get sort of webinars or teaching sessions or just flow charts even that say this is the process that we go through for something?
We do have guides for each of the processes, so each of the GP payments and pensions processes really. And then we are looking at the other guides that we've got for other services, so performance list, to making them the same format. So they're all now web-based guides, meaning that you can easily navigate through them, click
Okay.
so that they're a little bit interactive, and you can download and print them as well. But it's a similar situation with the guides. There's some feedback stars in the back, and if you're not getting what you need from it, so if you want a flowchart up front and what's in there already isn't ticking that box for you, give us that feedback in the stars at the back and we'll look at adding it. If enough people do it, we know it's a priority and we'll make it one.
Okay, so looking at that feedback function online, and if the just isn't the guide for what you want, speak to your IGPM rep or message us at IGPM and we can feed that back to Rob.
Yeah, I think the important thing is like we'll try and tackle the most in-demand things first. So if we're getting it through the feedback and we're getting it through IGPM that you want our flowchart, for example, and it's overwhelmingly clear that that is what is needed, that is what we will prioritize. Like we don't want to waste our time creating guides and videos and whatever else if people aren't going to use them.
Yeah.
So tell us what you need to make them useful to you.
Okay, great, thanks. So some more kind of general issues that our users have found or our practice managers have found, that when they look at the users for their specific practice, it doesn't give them an overarching view of who can look at their data, which has really concerned some of our practice managers quite rightly. What they've been doing is searching on a person's name and then coming up with hundreds and hundreds of names that don't necessarily work for their practice. So that user management function, can you explain that and explain how that's going to have some improvements? Well, I hope it's going to have some improvements.
When we were just dealing with supplies and medical records, I think it was easier to kind of manage user management without having that holistic view of all the users who've got access at your practice. But since we've launched Performance List and then GP Payments and Pensions, it has become apparent that you do need that functionality to see everybody who's got access at your practice and to what, which is absent from the system at the moment. We can see it as PCSE behind the scenes, but we do have a change in progress so that we can have a customer version of what we see in user management at your end.
Okay.
So I don't have specific dates because everything goes through like a development, test, deployment cycle. I believe that is developed and tested and is just waiting to be deployed into the system, which means making it live so that you can see it. But because we have like other things that are a bit more high priority, those things are going to be deployed first and this will come after. But it is looking like it's going to be 2021.
Oh, so it'll be before the end of this year?
It should be, yes.
Okay. So if a practice is particularly concerned about who has access to their system, so if they know they've had a change in practice management or a change in staff, can they ask you, or when I say you, I mean ask the help desk for that verbally? Would they be able to say who's got access?
Yeah, so we'd be able to do it verbally, but for some practices, you'll go on and there'll be like a list of potentially hundreds of roles that have been assigned at the practice and to who. So maybe doing it verbally is not the best way to do it. But if you go to our website, we've now got a user management tab. So if you go to pcse.england.nhs.uk, in the blue barrel on the top, there's now an option for user management. And on there, there's an email address for the team.
Okay.
I think it's user registration in the email address, but it's the user management team.
Okay.
But if you email them, I'm going to say it needs to be like a user administrator at the practice, somebody
Yep.
who can set up and deactivate users. If they send an email in, then they can let you know who we've currently got set up and in what roles.
Okay, and then because that's a kind of super user at the practice, they can say which ones stay and which ones go.
Yeah, or you would do that yourself as a super user. So you would then log in and deactivate the ones that you don't want or change the roles.
Okay. Okay. It's been really useful to go back through some of these questions this morning, Rob, and have some real specific answers for our members. Is there anything else you want to add?
The only thing I would say, Kay, is I think it's been really useful for us to have this question and answer session. I'm looking forward to continuing this relationship with IGPM, and just for everyone watching to be assured that we know about the things that are wrong and we are working on them. And I would expect between us having this conversation and some people watching this that a lot of the things will have been fixed and we will have let you know by now.
The other piece of materials that we're going to put out along with this is a document with some questions and answers and some kind of web links. I think we're going to do that as a PDF. I know your team have been working on that, so we'll make sure that not everybody likes to watch a video, so that there's something written to go along with that as well. So it's important that our IGPM members and practice managers across England know they can go to YouTube, they can go to your website, they can watch this video, they will have a document to look at alongside it, and we'll continue to try and work with you to get this right, and we'll perhaps do some more videos later on in the year, some more webinars.
Yes, we've covered quite a broad range of topics in this Q&A session, but it'd be good to like narrow down on some specific scenarios and topics and do some sessions on those.
Yeah, and if you've got any ideas of how to do that, if you contact your regional rep or if you email the IGPM, you can do that on Facebook. You can tweet us, you can email us, and we can then start to collate and really go in a bit more depth about other topics, and perhaps we can do some screen shares as well, Rob, and see things in real time. That might be helpful moving forward. But I'm really pleased that we've been able to go through these questions and understand that we've been in a bad place, but we know we're coming out of it now.
Yes, absolutely.
Okay, so thank you everybody for watching today, and we'll see you next time.
Thank you.